interested with Homeopathic Research and Information Center, huh? Yeah. Are you interested with Homeopathic Research and Information Center, huh? Yeah. You want to say just a word or so about? No, you don't. He gave me a very nice study that they're doing where they're correlating different cases, and there's only two that are in English, and this one is on carcinsoin. And it seems to me that in Europe, people have spent more time working out many of the details of carcinsoin, and they've used the remedy much more than I have, for example. So this is how many cases? 56 cured cases of carcinsoin in this pamphlet, and I think it must be very good because if they're really cured cases, this is the best place to learn from. So maybe even much more information about carcinsoin in here than what I'm going to give you now. It's edited by Dr. Groot. What? Belgium. Okay. Anybody who's interested, we can give you the address. Yeah. Okay. Shall I just read it now? Here. Why don't you just tell your address? Yeah. So, what I can tell you about carcinsoin. I've noticed that their people usually, they have a dark color. The skin is generally, dark. Or earthy, what we call earthy color. And sometimes oily. The skin is slightly oily. It's not necessarily unhealthy, but they generally are. I mean, the skin itself doesn't look bad. It looks okay, but you know how some people, they just have a dark complexion, quite a dark complexion, brownish. Olive, but even more to the brown side. Yeah. What? In black people, no. In black people, you don't get that. You don't give it to all black people automatically. Yes, you may find that. And also, you know these cafe au lait spots? Yeah, but not necessarily von Recklinghausen, but that spot, yes. And very frequently they have lots of moles. It's a no-sode, and so we expect to find in the family history what? Cancer. At least 90% of the cases that I've seen have had a history of cancer, and not usually just one, but many cancers. Now, that doesn't mean the grandmother died of cancer at 85. That's not what it means. It means that somebody is dying in their 40s or early 50s with cancer, right? Or maybe 3-4 of the women in the family, they died with breast cancer. The aunt, the mother, strong history of cancer in the family. And when I first heard about the remedy, I thought, oh, so it must be a very good remedy for cancer. And George says that he's seen it very rarely indicated in cases where it actually has gone to the point of cancer. Once it gets that far, mostly it goes to another remedy. When I've noticed it the most, and also what George has told me, is that in chest conditions of one sort or another, allergy and asthma and chronic bronchitis, relapsing bronchitis, where where well-indicated remedies don't work, or they work and then they relapse quickly. I saw exactly that. It was a case of a woman with bronchitis, and she came first with a bronchitis. She was coughing. It would wake her up in her sleep. She was very warm. She had to uncover. She had no thirst. Perfect case for pulsatilla. So I gave her pulsatilla, and the cough got better for 1 or 2 weeks. Went away completely. Then she developed a cough that came on at 1 a.m. every night with a thick greenish mucus, or yellow-green, and she had a strong sensation like a hair on the tongue. And so I gave, of course, no. Calibicromicum, right? 1 a.m., cough 1 a.m. with thick mucus and sense of a hair on the tongue. Silica, yes, is the main remedy for hair on the tongue, but Calibicromicum also has that as a keynote. And it worked again 2 weeks, and then it relapsed. And after 2 relapses, I brought the case in for George to see, and he met her in the hall as she was leaving, and she had a very dark complexion. He said, "Why didn't you tell me?" She had such a dark complexion. And we gave Carcinsoin, and she did very well. Cleared up the tendency. Now the children seem like sepia, thin, excitable, and lots of energy, very excitable. And they also have another point in common with sepia, which is what? Dancing. Very good. Tendency for dancing, desire for dancing. The adults tend to be intellectual, very intellectual, studying hard. May have tendency for depression, also irritability. Many times they'll have a lot of energy and high sex drive. Also in the children may start to have masturbation early. There's a tendency to be fastidious. So you can see it may be easy also to confuse with what remedy? Arsenicum and Nux vomica, both. They tend to be warm. But they can be also chilly. I said amelioration at the sea? Yeah, amelioration at the sea. The food desires, there's usually for sweets, salt, alcohol, and fat, or may have also an aversion to fat or to alcohol. And sometimes there will be a desire for garlic or onions. Garlic or onions. Also, sometimes there may be an aversion to sweets. Another keynote is severe burning pain in the colon. In the colon. And sometimes it feels like it goes up into the colon. Burning that extends upward into the colon. Constipation, especially in children. Constipation in children where the stools are like small hard balls. Even harder than sheep dung. It looks more dried out. Asthma ameliorated at the sea, like Medorrhinum. You can see it would be easy to confuse this remedy also with Medorrhinum, huh? Yeah, that's mostly what I know about carcinosin. So, the blue sclera, yeah. It's said that they have the children have blue sclera, but I've noticed a lot of children have blue sclera, and I don't know when it's an indication exactly. It seems that it has to stay beyond the normal length of time to be an indication. The blue sclera of the eyes for tuberculinum. Yeah, maybe. Calc-Foss, you saw. Until what age they stayed blue? Oh, I see, that late, yeah. It seems to be more or less normal for babies in up to 1 or 2 years of age, but if you see it later, then it may be an indication for things. Sometimes it's hard to use these indications that aren't really pathology. You have to be careful with them.
Children's diseases in adults.
Yes? Like if they get measles when they're an adult. He says childhood diseases that come in adulthood. In other words, an adult that gets mumps or chickenpox, something like that. Did they have it also as children and then it came back, or they just never got it and then late in life?
The problem is that their immune system is not strong enough to have the disease as a child.
I see. Is this in depleted type of cases? Depleted cases. Okay. Nice. Huh? Frequency for me is small. But I have to admit that I've been convinced by some of the British and other Europeans that I've talked to that perhaps I underprescribe it. I know one homeopath that says he uses it, a very good homeopath that says he uses it as commonly as Medorrhinum, which is one of the, say, 15 most common remedies that I use. So I don't know if it's so. You use it that commonly also? Once or twice a week. So I don't doubt it. I just don't know it well enough to say that it's. So you used it quite often, so let me just ask. In Britain, I know a very good homeopath that was describing what he thought was the personality, and he said was in women that look like Staphylos aureus, that they seem very suppressed, but not sexual like Staphylos aureus, but as if they easily pushed down by life and sweet, very gentle. You had that experience also?
tend to are very dependent on the opinion of others.
Yeah, that's what he said.
Love and like by
This is something you noticed on your own, or you heard it from... No, you just noticed it on your own. Come up and say. Yeah. Okay.
They are usually very sweet, and we notice that it's a complementary remedy with pulsatilla.
So sweet.
Alike pulsatilla, but they are more sexually aroused, and they are more fastidious. Pulsatilla can be too, but just not demanding. And carcinogenic can be very demanding.
Sexually demanding.
Order.
For order, yeah. Fastidiousness, definitely.
But in his work it is because you cannot stand, or they cannot stand, to be reproached. When you tell them you didn't do it right, they will get sick of it. So that's why they are that fastidious. They want to overcome the possibility that they could be reproached. They're very sensitive to music. They weep from music.
Weeping as well as dancing, huh?
Very sensitive to atmospheric things like thunderstorms. They go and look for it, and they weep, and they get
goosebumps.
Goose flash from it. The emotion that it gives. A waterfall.
I see. The waterfall because it's atmospheric, or just because it's beautiful?
The force. The plane that's starting or moving. They're really thrilled by the force of it.
I see. Something else? A lot more, yeah. Okay. I don't know. Do they all look dark?
No.
No.
But they have the tendency to,
Freckles and moles, yeah. Nevi, yeah. Good. I think perhaps that they have, since the health is better in Greece than in Europe in general, I think perhaps they have less of this particular miasm in Greece. So I didn't learn to recognize it.
One of the things, the analysis, the family of analysis is diabetes, this is sure.
Yeah, that I've seen. Tendency in the family for diabetes.
And in the person itself too.
And in the person, diabetes.
You find it very frequently in diabetics.
In diabetics themselves, yeah. Okay. He says also family history of diabetics and in the patient themselves, frequently diabetes. And with a personality like pulsatilla, but more orderly and more sexual and demanding. Yeah, sure. Yeah, yeah. But nice and then obstinate, both.
Nice in a way that they are very sympathetic.
Yeah.
They will help people and they will feel good just to be able to help people. But this is because they want to be loved. It's not just giving.
I see.
They want to be appreciated.
I see. Very interesting. So I'll pay attention to that. Anybody else wanted to comment about carcinosin? Yeah. Yeah, too intellectual. I've noticed that. The children as well, you say. Yeah? I've seen that the people themselves can tend to be overly intellectual, but I don't know if I've seen that the children are too intellectual. Prematurely adult. Precocious.